Do not eat any solid food at least 8 hours before your C-section. What's up, beautiful people? Welcome to another exciting episode of Labor Room with your pregnancy partner, Dr. O. I'm so excited to be here as always, and I have another interesting topic for us to trash and discuss today. Yeah, if you have a C-section coming up, can I see your hands up? Yeah, okay, that's fine. Even if you don't have a C-section coming up, you should be watching this episode because, like I always say, sometimes C-sections are not planned, they just happen. So if you are pregnant, you should be watching this video. Of course, no one prays to have an emergency C-section, but if you find yourself in those shoes, or if you find that you have to have one, you want to be prepared for it, right? You don't want to go for a C-section and be totally unprepared for it, even if it wasn't scheduled. So that's why this video is for you. Your pregnancy partner, Dr. O, always has your back, so there are no surprises for you in pregnancy. And I'm going to be telling you 5 things that you must not do when you're having your C-section. My number one, don't try this if you're having a C-section. Do not eat any solid food at least 8 hours before your C-section. Now, some hospitals will allow you to drink clear fluids up to 2 hours before your scheduled C-section. However, note that I said clear fluids. So clear fluids literally means that you can see through the fluids, right? So we're talking about water, we're talking about apple juice, we're talking about tea without milk inside, just tea alone, right? Anything that you can see through it is pretty much clear fluids, and you're allowed to take that up to 2 hours before your scheduled C-section. Nothing less than that, nothing later than that, okay? Now, let me explain why I said, because some people will be like, what? I'm not going to eat food for 8 hours? Why? Why shouldn't I eat? How am I going to give birth? How am I going to breastfeed baby if I don't eat? Okay, just relax. It's not that deep, okay? I'm going to explain to you why doctors don't want you eating at least 8 hours before your C-section. And it's really simple. You see, when you take food, when you eat food, food is going to be in your stomach for a couple of hours. Now, when you take solid foods, your tummy is going to be full. And remember that when you're having a surgery, you are lying flat or at the most at an angle. Now, remember that when you're going for any type of surgery, not even C-section, now you're going to have something we call anesthesia, which is to help you to numb the pain so you don't feel the pain of the procedure. When you're going for a surgery, there are different types of anesthesia that you could be given. They could give you a general anesthesia. That's the one where you most likely will put on a mask and they will put you to sleep. When you're given that type of anesthesia, it relaxes the swallowing muscles. Not only that, when you're lying flat, there's a tendency for fluid and food to flow from your stomach all the way back up through your throat and back into your mouth. Now, when this happens, bear it in mind that there is a connection at the back of your mouth between your respiratory tract, that's the one that is responsible for you breathing in and out oxygen, and your digestive tract, which is the one through which food gets into the body. Now, imagine that food has flown all the way back up to your stomach and is now in your mouth. And remember, you're not sitting upright, you're not standing, you're lying flat. What can possibly happen? Just try to imagine. Now let's picture it together. I'm going to have a picture somewhere up on the screen so you can see how it works. So there is that risk of this food or fluid that has flown back up into your mouth getting into your respiratory tract, so it can actually get into your lungs. And you can imagine if food gets into your lungs, it can cause so many complications, which we're not going to go into talking about today. But trust me, you don't want that to be you. But take note, when you go for a C-section, the type of anesthesia you most likely will be given is something called a regional anesthesia, where they numb out the area that they're going to be working on. So basically, from your waist down, you're going to be numbed. You won't feel any pain. All you would feel there is just pressure. However, There are times when, for whatever reason, regional anesthesia could fail and they have to put you to sleep using a general anesthesia. So imagine if you confidently thought that, okay, I'm going to have regional anesthesia, therefore I'm going to eat all the food in the world, and suddenly you have to have a general anesthesia, especially if it's now an emergency situation that cannot wait. You'll be putting yourself at potential risk or danger of food getting into your lungs, and you don't want that. So even though most C-sections are not carried out using general anesthesia, you want to, as much as possible, make sure that you obey the rules and don't eat 8 hours before your scheduled C-section, just to avoid any eventualities that might happen. Now you might be wondering, why am I allowed to take clear fluids up to 2 hours before my C-section and I cannot take solids? This is because solids take a longer time to digest than clear fluids. So inevitably, if you're not able to fast for so long, then doctor might let you take clear fluids up to 2 hours before your C-section. Also bear it in mind that the fact that you're not getting food through your mouth does not mean that you cannot get fluids via other routes. So when your doctor has said you can't eat before your procedure, you will definitely be placed on something we call IV fluids, popularly known as drip. So you'll be getting fluids into your veins. That way you are not dehydrated and you stay hydrated. Because I always advise in pregnancy that you stay hydrated always. Now, for our number 2 don't. You see, all our fashionistas in the house, can I see your hand up? If you're a fashionista in the house, you like to put your nail polish and all that, bling blings. Sorry to burst your bubble. When you're going for a C-section, you should have no nail polish on. This is not the time to do fashion. You're not going down the runway. You're going to the surgical theater. It is not a photo studio. So please get rid of nail polish before you get in there. Now, why did I say this? I'm not trying to spoil your shine or anything like that, but when you're going for a surgery, there's a little instrument called a pulse oximeter that we place on your fingertip, and this instrument is used to check your oxygen saturations. So this is basically the concentration of oxygen that you have in your blood. So when you don't have enough oxygen, the instrument alerts us and we know, so we can quickly intervene. Now, imagine that you have nail polish on your fingernails and we attach this instrument to your fingertip. Just try and imagine with me, what do you think can possibly happen? Well, you can probably guess. Your guess is as good as mine. This nail polish might interfere with the readings of the pulse oximeter, and then we start to get inaccurate readings. Now, inaccurate readings could be 2 ways. You have enough oxygen and it's falsely telling us you don't, or you don't have enough oxygen and we are thinking everything is fine. Trust me, you don't want the latter to be your case, where you actually don't have oxygen and we don't even know, just because you wore nail polish, right? So save yourself and save us the stress and just get rid of the nail polish before the surgery. Thank you in advance. The next don't that I'm discussing today will be pretty much along the lines of my number 2 point, which will be do not, I repeat, do not put on makeup when you are going for your C-section. I know a lot of us like to look good. How can I be caught on fresh? Well, sorry to burst your bubble once again. You can still look fresh without makeup, And this is not pointing fingers. I'm not judging because I know I'm wearing makeup and all that. So just remember that when you put makeup on your face, now just imagine this. Again, this has to do with oxygen. When you don't have enough oxygen, so one of the signs that can help doctors to see this during your surgery is when your lips turn blue. When your lips turn blue, this is something that we call cyanosis in medicine. So it tells us that you don't have enough oxygen. Now imagine if you have put on a red lipstick and you've totally covered your lips. If your lips turn blue, how on earth is the doctor supposed to know? So you don't want to be putting yourself at risk just because you want to look good, right? You want to be safe and you want your baby to be safe. So save the whole looking great for when it's time for the photo shoot for the naming ceremony, right? Skip all that part till the naming ceremony and just focus on your scheduled C-section for now. Trust me, the doctor is not looking at your face. We already know you are beautiful. The focus is actually going to be on the baby and not you. So you might want to remember that when you're putting makeup on. Now, the number 4 don't that you must not do when you're having a C-section is make sure that you do not put on any jewelry. Don't put on any jewelry. Now it's beginning to look like we're trying to make you look ugly for your surgery. On the contrary, this is not the case. We want you to look good, okay? We want you to look great. However, we also want you to be safe and your baby to be safe. Now, the only type of jewelry that is allowed in the surgical theatre is wedding bands, and that's really for sentimental reasons. We usually don't like any form of jewelry, just because jewelry can actually harbor bacteria, right? And we want to make the surgical theatre as sterile. Sterile means it's clean, there is no bacteria, right? So we want to make it as sterile as possible for you and your baby so that there are no complications and you're not going to have any infections after the procedure. So you don't need to be putting on any extra rings, you don't need to be putting on any bracelets, any wristwatches, any of those kind of stuff, right? We really don't need that so that you and your baby are in top shape. We really don't need that. So please do away with them until after your C-section is done. Thank you in advance once again. And the last but not the least, the last point that I have to make is make sure that if you're having a C-section, do not, I repeat, do not shave your pubic area. Pubic area, for those who don't know, is the area, your private part area, or your lower abdominal area, so the lower part of your tummy. Do not shave that area at least 24 hours before your C-section, right? You can shave 48 hours before, 72 hours before, a week before, but when it's that 24-hour window before your C-section, do not shave that area. This is because most times when people shave, they're using razor blades, right? They're using shaving sticks which have razor blades in there. And unknown to you, these razor blade or shaving sticks could actually create small cuts on the skin. And these cuts on the skin can actually serve as channels for bacteria entering the skin and causing infection, either after your procedure or during your procedure. So for example, if bacteria is already entering the skin, right? Just imagine what will happen when they cut through the skin, right? The bacteria will gain further entrance into your body, and you really don't want that happening, right? You don't want that to happen. So best thing is, if you just realize all of a sudden that, oh my gosh, I have so much hair down there and I don't want the doctors looking at me somehow, even though nobody's really looking at you, right? Make sure that if it's within 24 hours of your CS, just leave it. Don't touch it. Leave it alone, right? Because the hospital staff can do the shaving for you on the day of your C-section, right? They'll use sterile instruments, disinfect the face first, and then shave, right? So if you haven't shaved before then, just leave it. We'll do our work. Don't do the work for us. Better to be safe than sorry. Okay? So that's all the points I have for you today about C-sections and what you should not do before your C-section. There'll be more episodes coming up about what a C-section is, how to be prepared for your C-section, and different things like that. Look out for that in subsequent weeks, right? Again, if you are not subscribed to this channel, if you are not a member of our Ozone community, what are you waiting for? Click subscribe button now and share this video with anyone you think that needs to see this. Thank you for watching. It's always a joy to have you around. Like I always say, every pregnancy journey might be different, but your pregnancy partner, Dr. O, remains the same. See you again next week.